watching Quad Cities Live.
Staying healthy is more than fighting illness. It's about preventing illness as well. And that's the focus over at Vitality Wellness Center in Davenport. Dr. Joseph Brooks is joining me now to answer all of our questions. Welcome to the show today, Dr. Brooks.
Thank you.
Thanks for being here.
Excited to be here.
Yes, we are excited to talk with you, and there's so much to talk about. So first, let's start with you, though. Let's learn more about you and a little bit of your medical background and how you got into this wellness space.
Yeah, sure. I'm an osteopathic physician, so I'm a DO, and I've been in the Quad Cities practicing medicine for 13 years, I think, and raising my 4 kids and family here in the Quad Cities, so it kind of feels like home.
Yeah.
Yeah, and so about 2 years ago, I decided to start my own practice, and we started out with Vitality Physical Medicine, and this year we're expanding to Vitality Wellness Center, and so I have 3 board certifications in physical medicine, rehabilitation, and pain management. And I'm certified in diagnostic and interventional musculoskeletal ultrasound, which just is a kind of fancy way of saying I can help an ultrasound machine see a needle get to a joint or a tendon or bursa, something that might be causing someone pain and discomfort. And so I've just gotten a lot of training and continuing medical education on how to help people recover from those kind of injuries.
Yeah, that's huge. And I'm sure you see a variety of patients with a variety of different issues that they're trying to get resolved, from pain to other things.
Yeah, I think part of the osteopathic philosophy is kind of seeing the whole patient, or trying to see a person first and maybe the disease that they have second. And so I hope, and one of my missions at Vitality is to kind of tailor the care to each individual patient. It's not really cookie cutter. It's really learning who they are and what their goals are. Being a physical medicine and rehab doctor kind of means that I focus on people's function and quality of life.
Yeah.
And so kind of my whole mission is to help people stay as active as they want to be.
Yeah, that's great. So you have 5 core services at Vitality. So we want to go over what some of those services are. Now, the first one is using the body's natural healing mechanisms to treat pain and improve function. So that's kind of what you were just describing right now. Is this the regenerative work that you do?
So regenerative medicine, also called orthobiologics,
I'm glad you said it,
is a new science, and a lot of top literature has been coming out over the last 10 years showing that we can use our own body's healing factors, growth factors, to heal parts of our body. And so there's 2 main treatments that we offer at Vitality. The first one is called platelet-rich plasma, which simply means we take a blood draw from you, we concentrate the platelets, and then with this platelet-rich plasma, we can inject it back into tissues like osteoarthritis, tendinopathy, and rather than trying to cover up the pain, which is I feel like is commonly done with a cortisone injection, we're actually trying to heal the tissue with your own body's healing factors. So I really like the fact that we're kind of using what's already in you, so it's really safe. But the newer and kind of more exciting thing is also bone marrow. So bone marrow has a lot of platelets and a lot of stem cells and mesenchymal cells that we can concentrate and then inject in a similar way back into joints and tendons to help people be more active and heal faster.
That's amazing that you can do that.
Yeah, and I think it's really important for the patients to kind of do their research before they do something like this. Because there's a lot of shady characters, I think, out in the space promoting stem cells when they are not supposed to be. The FDA's really kind of come out against advertising that for a good reason, because there's been some people who have not been doing things right. That's why I actually joined a national leader in the space called Bluetail Group, and we're affiliated with them because they work with the FDA, and they're doing research that we'll be helping them with on bone marrow aspirate concentrate concentrate to try to show long-term efficacy. They've been doing studies for over 10 years on the long-term benefits. They have shown some incredible outcomes with knee osteoarthritis, kind of pretty much preventing joint replacements in lots of patients.
That's amazing. It really is. Some other things, medical weight loss, which is a hot topic right now, but you can really help guide people through this space, because you see a lot of people out here kind of flailing around trying to figure out if they want to do this, if they don't want to do this. You can really help people decide.
I think at Vitality it's ideal because we have physician oversight to medical weight loss, and some of the newest science like the GLP-1 receptor agonists like semaglutide. Medicines like that are just blockbuster drugs because of the level of research coming out. It just comes out every day. And we're really excited to utilize that as a tool in the right patient, but we're going to have to screen a little bit to kind of make sure it's safe for people. I would worry for my own family member to get online and just order some medicine from Canada or something. People are doing some things that I think they need to be a little bit careful about safety.
Checking in with somebody.
So I think you want to do the proper workup first, but for the right patient, I've been doing rehab for here in the Quad Cities for 13 years, taking care of people with strokes and other age-related diseases. There's so much research showing that this medication, which treats chronic obesity, actually reduces the risk of stroke, reduces your risk of heart attack, makes you healthier, gives you more energy, reduces pain and inflammation in your joints. So kind of looking at the bigger picture, this can really be an effective tool to help patients get going again, get more active, and live the life they want to have.
Yeah, you're a proponent, but you're like, let me help you do that safely. Some other things, you can get IV vitamin infusions. So we've heard of this before. It's for hydration, it's for immunity. There's all kinds of options. There's a literal menu on the website where you can choose what you want to do, which is hugely popular. Massage therapy and nutraceuticals.
Yeah. So with the IV vitamins, I think that it's important to go somewhere where you feel like there's medical supervision, where it's going to be safe, where they have high standards, where they make sure they clean the site, where they make sure they're following all septic technique. At our facility, we have actually integrated ultrasound into ultrasound-guided IVs, so we can place them with more precision and less pain, not just moving around trying to figure out where to go. Because for me, I don't really like needles. So so my IV nurse is great. She has 8 years experience, and we want to make sure we have ultrasound to be able to get it right and safer. But then with the hydration, I think that really optimizes a lot of people's health. We're just so dehydrated. With the vitamins and minerals, we're probably not eating right, all of us, and if we're trying to optimize our health in 2025, if you're kind of getting on what I call the vitality journey, then this is kind of supplemental to that. I think it can optimize also some of our health and metabolism. If you're going to be going and doing an orthobiologic procedure, it complements.
Well, so much knowledge. I'm so happy that you were on the show today to talk to us about all of this. And here's the information on your screen, QCvitality.com, as well as the phone number if you'd like to set up an appointment or just call and get a consultation. You've obviously come to the right place. Thank you so much, Dr. Brooks, for being here today.